This is the month of March 2014. This is the last opportunity this month you have to get signed up for the Affordable Care Act. Here in the state of Minnesota, it'd be MNsure if you do not already have health insurance through your employer or through one of the government programs that has been made available or expanded. So what does that mean if you don't sign up for health insurance by the end of the month? Well, that means you're going to face a $95 penalty or 1% of your entire yearly taxable income, whichever one is greater. Your next opportunity after this month to open enroll in any of the MNsure exchanges or any other federal health care exchange, if you're in North Dakota, for example, will be November of 2015. Now, there are a handful of exceptions to that for if you move out of state, switch careers, blah, 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 but you're going to have to talk to somebody who's actually in the insurance industry to find out the litany of exceptions there are to that statement, because there are quite a few. But in general, that is the idea. So what does that mean for people? Well, got to get signed up or face the penalty. But what's interesting is we've transgressed through the last year of getting the Affordable Care Act really implemented. Going back to last October, we've heard of lots of exceptions. And one of them appears to be coming back once again. And it's just in time for the upcoming election. This is what it is. If you remember, back in November of 2013, shortly after the health care law took effect, suddenly millions, and I do mean millions of Americans, received cancellation notices on their health insurance. Health insurance they were happy to have. Health insurance they were happy to pay the premiums for. And many people were confused by this because the president had repeatedly said during the time this law was being enacted and being put together that if you liked your health insurance you had, you'd be allowed to keep it. What people did not realize until the fall of 2013 is the fact was if the president's administration liked your health insurance, you would get to keep it. There are 10 key things that he says you need to have in a policy for it to be acceptable. Any program or any policy that didn't have those 10 key things was then deemed illegal or canceled. That's what millions of Americans were finding out. The president then backtracked back in November of 2013. This is after the website debacle started to get better, and you remember how crazy it was back then. Government started working again after the shutdown, etc. He decided to allow states to keep those policies for one more year, even though they were, quote, bad policies to the president and didn't meet his expectations, in order to help save the people the pain and burden of that first year and help him at least salvage some of his campaign promise, which turned out to be a promise he really could not deliver and really couldn't keep. Kind of like the $2,500 a year the average American family would see with this health care law. I haven't heard of a single family saving that much. All I've heard is people pretty much staying the same, maybe paying a little bit more, maybe paying just a little bit less. But here's the kicker. Here's the kicker. This is really what it comes down to. You know why he extended this? It's nothing to do with you and I. It's nothing to make it easier for us to get health insurance. It's to save face for his political allies in the midterm election. There's no secret the Democrats are probably about to take a drubbing. No chance to take the House away from Republican control federally, and they could very well lose the Senate. This is an attempt to save the Senate, and here's why. If you remember when those cancellation notices went out last year, it was that October-November time frame. Well, October 1st, those mailings would come out again. They got to be out 90 days before the policy is canceled. They would be canceled at the end of December, which means in early October, people would start receiving cancellation notices, reminding them of what can be perceived as a failed domestic policy health care law 6 weeks or 5 weeks before the election. I think the president knows he can't survive that kind of political firestorm. That's why this has been a year extension. It has nothing to do with helping us. It has nothing to do with the health care of America. It has everything to do with trying to make sure he's not a complete lame duck president his last 2 years in office.